You know, that's the fun thing, is that we're constantly making changes, the upgrades in our grand rounds. When I ask the residents, I always like to kind of go with what's really working, what's not working. Fairly recently, they told me our weakest conference was our journal club. And I said, all right, what's the problem? And they said, well, we don't necessarily get the kind of faculty participation that we want, and it's just not a fun experience. So I asked, what would be the best journal club you could possibly imagine? And they said, well, and again, this is all spitballing and brainstorming. They said, we want the entire faculty to participate. I said, we can work on that. They said, we want it to be fun. I said, we can work on that. And they said, we want dinner. I said, we can work on that. So in the end, what we ended up doing is creating a really fun chef-driven dinner with paired wine. The articles are very well chosen by our chief residents, and the entire faculty, based on the fact that it's kind of a fun event, usually does show up. Well, I shouldn't say the entire faculty, but a very high proportion of the faculty. And it actually has turned into more of a team building experience. Well, I really should say as much of a team building experience as an educational experience. But this is the kind of changes we're willing to make, because we really want everything in our program to be at the very highest level. The other thing about our program is that we are always delighted to consider changing. The world changes extremely quickly in the year 2020, and I think that will just continue to accelerate. So we've always been open-minded to changing the program. We do this in close collaboration with the residents. In fact, I think that communication is one of our great strengths and what makes our residency so special.
The biggest significant change in my mind is the fact that Faisal Yafi's here and we've developed a whole program in men's health around him. I think that's the area that's going to grow and take off like a rocket ship. To that end, Dr. Landman has been successful in expanding our practice, so we're not just in Orange, and now we have new offices in Birch Street and Newport, where Dr. Yafi is working, but also all of us are also attending there. And I know Dr. Landman has on his master plan, if you will, other areas into which we're going to be opening up. So the program has just been growing by leaps and bounds. When I was chairman here, we had 9 urologists. Now with Dr. Landman, we have 24 urologists. When I started out, we had 1 PhD in the laboratory. Now I believe we have 4 PhDs working in the laboratory. So it's become an amazingly strong program.
We have had some innovations in education involving the use of Zoom even before COVID, using Zoom for our grand rounds, which was an effort that was spearheaded by Dr. Clayman and has been very, very popular. We have upwards of 80 to 100 attendees for all of our grand rounds now via Zoom. So this is another innovation that we're very proud of. The growth of the program are other additional strengths, as well as the quality of our residents. Our residents uniformly have gone on to pass their board exams. We haven't had any failures in either the written boards or the oral boards. We've had consistent resident achievement in terms of going on to fellowships.
Since I got here in 2017, the program has just grown substantially. I think what I really enjoy about our program is some of the new addition of a global health curriculum. We have now offered this for our 4th year residents in their PGY 4 year to travel abroad, typically with me, but we also have other attendings who are also interested in do mission trips as well. And so this is an elective that the residents can do where they spend a week somewhere in the world and work with patients and outside urologists in that country. It's an amazing experience, and I think it's very unique to our program. We also have a mentorship program here at UCI where residents are able to choose what faculty they would like to have as their mentor, where the resident and faculty then meet on a quarterly basis and not only talk about career development, research, but also just personal development. And I think that's a huge advantage for the residents here.
Medical education, much like a residency program, always needs to be developed. It's always changing. It's always a process. And if you're not changing, you're basically going backwards. And I think that's what we're consistently doing. I myself like to focus on educating residents in terms of electronic health records, coding patient diagnoses, and then providing cost-effective medicine, because that's really the future of surgical training and urology training. And I think we do that particularly well. Our residency program really is the intersection of technology and humanism, and I think that's what makes makes a quality residency training program for all of our residents.